Testing active range of movement at the knee joint during flexion. For this, I ask the client to try and get their foot to touch their bum while ensuring their heel maintains contact with the bed. This gives us as practitioners an indication as to how far the client feels comfortable to move at the joint, which may highlight any pain the client has, and allows us to compare each knee to the other to identify any abnormalities or differences between them. This is also testing active range of movement at the knee, but for extension. I ask the client to start in a bent knee position and straighten their leg flat out onto the couch. The client should be able to get their leg straight, but some may not due to injury in perhaps the hamstrings, while others may be able to straighten their leg even further where their heel lifts off the couch, and this is called hyperextension, often due to hypermobility. Here I am testing active internal and external rotation of the knee joint. For this, I ask the client to turn their lower leg so their foot faces my hand, and I do this on either side of the foot. Clients will often mistake this instruction for ankle inversion and eversion or hip rotation, and if this is the case, then a hand can be placed above the knee to try and manipulate it into the correct movement. This is another example of a method for testing active range of movement at the knee joint for extension. For a client who is hypermobile, asking them to dorsiflex their foot while doing this movement will make it more challenging for them and give us as practitioners a better gauge as to how good their range of movement is, leading to better comparisons and conclusions being made. Next is testing passive range of movement for flexion at the knee joint, and this is caused by an external force. For this, I stabilise the top of the thigh and push the heel in as far as it will go. For this client, this does not show me their full potential as the heel cannot go any further, however the joint had more to give. This is another method for testing passive range of movement for flexion at the knee joint. This is more appropriate for this client as in this position their movement is not aided by hip flexion, thus putting more responsibility on the knee joint's range of movement, which is the focus and purpose of the test. Testing passive extension as shown here may be appropriate for clients like this one whose joint show signs of hyperextension. This allows us to test the full potential of the joint and get an idea of the end feel, which is a sensation that I get in my hands at the extreme end of a passive range of movement, showing me that the joint cannot be moved any further. At the knee, this should be firm but slightly elastic. Here, passive internal and external rotation at the knee joint is being tested. This should be around 25 degrees internal and 45 degrees external. Comparing the client to these values allows us to identify limitations to bony structures or connective tissue such as tendons and ligaments, in this case particularly the ACL. This is testing of resisted knee flexion in the prone position. This assesses the strength and function of the muscles involved in knee flexion. This is an isotonic contraction as the muscles change length while contracting. Here the hamstrings concentrically contract, meaning that the muscles shorten in order to resist the force that I'm applying at the distal calf to the joint. Here I am testing resisted flexion and extension, but this time isometrically. This means that the leg stays in the same position as the muscles remain the same length whilst contracting, to resist the force that I'm applying to the knee joint. Isometric resistance testing is important as it can help practitioners detect neuromuscular dysfunction, and it can help track the progress of patients undergoing rehabilitation by measuring their strength, which can be compared from session to session. This is the test for resisted internal and external rotation at the knee joint. Here it is being done isotonically, but it should also be done isometrically. Here the client pushes against an opposing external force which causes a change in the joint angle. Not being able to do this can indicate signs of injury and may also be the reason why other movements are weak or minimal. Finally, here is the functional test for the knee joint. I ask the client to lunge forward on either leg at full depth and have them do roughly 3 repetitions for each leg for comparison. This allows us as practitioners to identify differences such as depth on each leg, wobbling while doing the movement, or placement differences such as distance or direction of the lunge. This can be recorded and used as a method of measuring clients' recovery or improvement.